Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. This is Josh Sharfstein. Today, autonomous vehicles, better known as self-driving cars. Just how safe are they? I speak to Dr. Jonathan Asani, an expert in traffic safety at the Johns Hopkins Bloomberg School of Public Health. Since this podcast was recorded, the National Highway Traffic Safety Administration forced Tesla to recall more than 350,000 vehicles with so-called self-driving systems. Let's listen. Dr. Jonathan Asani, thank you so much for joining us on Public Health on Call to talk about autonomous self-driving vehicles.
It's my pleasure to be here. Thanks for having me, Josh.
Now, I know your career has been focused on traffic safety. Tell me how you think of what an autonomous or self-driving vehicle is.
Autonomous cars, you can think of them like levels of automation. That's a term that's widely used in the industry, and you might have heard people throw words around like L1 or L2. And really, you can think of them as a continuum. A lot of us in our cars might have a feature like lane keeping or cruise control, but the cruise control could be kind of tethered to the speed of the vehicle you're following. Those are already in the ballpark of some automation. So those are called level 1 driver assistance features. Level 2 is the next level where some of those things become combined. So you might have a lane keeping feature running at the same time as your adaptive cruise control, which is the following. And then you can kind of watch the vehicle operate. And then you get into the next levels, which are increasingly the vehicle taking over. So there's a level 3, which is under certain circumstances, the vehicle could completely operate on its own, say in a highway environment or in a very well-mapped environment. And then you have the highest levels of automation, 4 and 5, where the vehicle is effectively driving on its own, and only under, say, the most extreme circumstances would the driver be asked to take over. All of them are currently being either tested or on the road. I would say that we don't yet have vehicles that are full driving automation available to the general public, but there's obviously been billions of dollars invested in trying to get us there.
In public health, we think about the benefits and the risks. So let's start with the benefits. Do you see safety benefits to automation in driving?
I do. I see safety benefits to increasing levels of automation in the vehicle. I'll give you a classic example. Earlier this week, I was driving my own vehicle. It's a 2021 Volkswagen small SUV, and my children were in the back seat. They were carrying on like children do. I was reversing. I wasn't keeping my eye on everything that was going on, and my vehicle braked for me, because I had missed the fact that a vehicle was passing behind me at high speed, and automatic emergency braking was activated in my vehicle, and we all lurched back in our seats because my vehicle caught an event that was unbeknownst to me. Automatic emergency braking is a perfect example of a type of automation that is already required in every new vehicle from 2021 onwards. This year, unfortunately, we hit a very grim milestone. We had the highest level of crash deaths on the road in 2021. The data have just come out at 42,915 people lost their lives on the road, which is an astronomical number in the mid-2015. And so the number was around 5,000 lives lower than that. So we are in uncharted territory as far as crash deaths are concerned. And we see technology as being one pillar in a multi-pronged strategy to reduce crash deaths.
Right. And I know that we could spend many podcasts talking about some of the other pillars, but just to proceed here, do you feel optimism as you think about the concept of more and more automation in cars? Do you think as you get to more level threes that will be a lot safer? Is that your hope, or do you think it's a mirage?
I think the jury is still out. And the challenge we have in making these projections is that what is in the market today is a mixed bag. And truthfully, we don't have good data to understand the phenomenon. So I'll give you an example. There are a lot of vehicles that have some levels of automation encoded and are in use on the road. Only recently did the National Highway Traffic Safety Administration come to an agreement for these vehicle manufacturers to share their data in a way that they would be able to quantify the safety benefit. So I think we're in our earliest days of trying to understand this phenomenon. I think once we as a community, meaning the public, the motorist, the road user, the manufacturer, and the safety community have a handle on how these should be properly used, then I think we're going to be on the right track to get towards quantifying the safety benefit. But, Josh, there's a number of precedents that we can rely on to say that we should be optimistic. Airbags are a vehicle safety technology that is automatic, and they save thousands of lives every year. Of course, there have been setbacks with airbags. The Takata airbag recall was the largest recall in US history. There were many problems with it, but simultaneously, and as you said, benefits and risks, even while Takata airbags were being recalled, there were airbags saving lives. I think the same thing could be said for these increasing levels of automation.
So let me give you an example. Tesla. I say this because you're describing a very early market for these kinds of automation technologies, but it seems like Tesla has been promising a lot more. And the people who have driven Tesla sometimes put up videos of themselves reading books or whatever while the car is driving. And the chief executive of Tesla has made some pretty strong database claims that his products are much safer otherwise. How do you think about those claims? Do you think Tesla's also are in an early stage and we should be thinking about it cautiously?
The vehicles that are currently available for consumer purchase in this country, the highest levels are at level 2. Very recently, I believe one manufacturer was approved for level 3. So level 2, remember, is that kind of partial driving automation, a combination of certain features that allow a user, as you said, to sit back, possibly read a book or feign going to sleep. I think all of those are prematurely optimistic reactions to a technology that has been very clearly shown and acknowledged by the manufacturers to not work under all circumstances. So we're in a kind of a messy, middling stage right now where you might just think that your vehicle has capabilities that it doesn't really. And sadly, there have been incidents where over-reliance on these partial automation technologies have led to catastrophic consequences.
And Dr. Azzani, if you were forced to answer the question, do you feel confident that those technologies now, if you use them in the way that some people use them, like kind of treated them as more autonomous, do you feel confident that that's at least safer than people driving? Or do you think that would be a way premature statement?
So myself, I would never fully rely on that technology. I would never. I would say that someone like you, Josh, knowing that you're kind of a sensible adult who kind of understands your responsibility to the general public, to yourself and to your loved ones, truly, and from the epidemiological data suggests this is true, that kind of the middle-aged adult cohort is like the safest driving population in terms of miles crashes or fatalities per mile driven. That to me would be the safe benchmark. These vehicles, as I said, the data is still not totally clear on whether or not they're safer than us. I would never fully rely on them the way that you may have seen people doing.
Right. For where the technology is today, you mean?
For where it is today, yes, that's correct.
How hard is it to make a fully autonomous car that's safe? I know that you said there's some level 3s. Those are not necessarily that a car can just drive anywhere, right? You can just plug in. That would be for a very specific set of circumstances. I guess I wonder whether you think, given that there's so much variation out there in the world, whether it's going to be possible to make something where you actually would feel comfortable pulling out a magazine.
This is I would say, several billion-dollar question, because a few very deep-pocketed entities decided to test that hypothesis. Where I think the dust has settled is that full autonomy is achievable under a set of circumstances. And the hard part of it is in what people call edge cases. You can develop technology that works almost all of the time. And then it's in those few unforeseen circumstances where no one could have predicted at that particular confluence of events where it may fail. So there was a recent study done by a group at RAND who tested the question, like, how many miles or billions of miles would be needed for us to show safety? And I think the answer was that it's going to take literally decades for us to get there if we use our conventional testing approaches. So in the absence of those standard benchmarks, the industry has been doing things like simulation. They create simulated worlds and they drive their algorithms on these night and day to see what happens here, what happens there. Some of them are taking a very rigorous approach with this, an approach that I would say is scientific and very measured. But even in those circumstances, by their own admission, it's not the circumstance that it would work all the time everywhere.
We are at this point, it sounds like, where there's promising technology. We're not quite sure how promising yet. There is a lot of research going on. There are some claims being made, perhaps, that are a little bit hyperbolic, or at least not justified by data at the moment in your mind. How do we get out of what you described as sort of a messy situation?
I would take a three-pronged approach. The first is that I would require safety data from anyone who is creating products in this space that would allow an independent third party to test them rigorously under different scenarios. Something equivalent to how does this technology behave in the wild, and also what would it take to pass something like a driving exam, if you like. So that's my first approach. So regulate data sharing at a very granular level. The second approach would be meet people where they are today and allow them to appreciate that these technologies are nuanced and complex. And you could do that one of two ways. You could either have educational campaigns that show people the limits of the technology, or you could do it another way. You could simplify the technology in such a way that it would become intuitive, and there would be an approach by the industry in a collective way that would make their technologies collectively understandable and accessible to everyone, and their limits would be apparent and clear, and that's not the case right now. The third one is perhaps where I think where public health should be looking, which is once you've done pillar 1 and pillar 2, you also look at the use of automation in vehicles that would maximize social impact. So safety is the ground floor. Without safety, there's nothing to work with. But recognizing that you've done 1 and 2, you'd also lift the vision of all of us by saying, let's use automated vehicles to get mobility to people who need it most. And then you're demonstrating social value beyond safety to include societal benefits. I think that's actually where the greatest impact could be made, recognizing that no mode of transportation is without risk. You take a walk down the street, you may trip over and fall. You get in an airplane, it's very unlikely, but it could crash. We're never going to be able to get to a mode of transportation that is without risk. I think the question is, how do we balance the risks and maximize the benefits?
Dr. Assani, this has been a fascinating conversation. Thank you so much for joining us on Public Health on Call.
It's my pleasure, Josh. Thank you for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.